Welcome to the Critical Care Obstetrics podcast. My name is Julie Arafay, Simulation Director at Clinical Concepts in Obstetrics. Today I'm going to be talking about deliberate practice and how to develop team skills. Before we get started, I want to remind you about a few ways you can learn with us beyond this podcast. At the Critical Care OB Academy, you'll find our full library of online courses designed to build confidence and skills in managing high-risk and critically ill obstetric patients. You can also join our community on Patreon at patreon.com/CCOB, where your support helps us continue our mission. On Patreon, you'll get access to exclusive videos, opportunities to interact directly with us, and deeper teaching pearls. And if you prefer to watch, our podcast is now available on YouTube. Just search for the Critical Care Obstetrics podcast. We'd love for you to connect with us on all of these platforms. So let's get started. Team skills are critical to optimize performance in an emergency. And what I mean by team skills are things like communication, role delegation, leadership, being familiar with your environment, calling for help at the right time, situation awareness, utilizing all available information and resources. If you're a nurse, you're familiar with these team skills from the neonatal resuscitation program because they teach them as part of the NRP. But how did we get these skills? How do we know they work? They were developed in aviation and the space industry and have been proven to improve performance in teams. So we know that other industries are using these skills successfully. So how can we use these skills successfully in healthcare? The latest data on maternal mortality says 87% of the cases are preventable. Now, whether you agree with that or not, that's still a very high number. And it may not be exactly 87%, but it's more than we would like to see. When you read the causes, many of the causes boil down to these team skills. And there's a few other reasons, but team skills are hugely, hugely important. So team skills can be a little bit difficult to teach because they can be hard to measure, and you can't learn them by watching a video, listening to a lecture, or reading about them in an article or a book. You can certainly appreciate what they are and be able to define them, but how do you implement them? That's where the struggle is. We're a bit different from other industries in that we have many different teams that come together and separate, even in a shift on the same unit. You're not going to have always the same people in every emergency on that unit. Some units might, but most units don't have that. And we don't have a lot of time to practice together and to practice in simulation. So when we do have that time to practice, how do we best utilize that time to practice team skills? There is no better way to really appreciate, utilize, and employ team skills. The best way to do all of those things is to practice them in simulation. Simulation is an ideal time to get these skills into the routine of how you do things on the unit. So practice, we know, is hugely important. So typically, you will have a simulation day consist of coming in, maybe a little talk about what simulation is, confidentiality, agreements signed, whatever information is in the briefing. Then you may have some skills practice and then go to the sim and the debriefing. So, what I'm proposing is just a little bit different. Instead of just practicing technical skills, how about practicing team skills and then going into the scenario in the simulator? So, what do I mean by that? So, if, and I talk about deliberate practice a lot, and I have used it extensively, and I have used it very successfully. So, if you think about deliberate practice in its truest form, it is used in a repetitive way to master a skill. So, it's often used in basic life support or even ACLS. And what you'll see is they will start the resuscitation. And if there's a mistake, they stop the practice, explain what the mistake is, and start from the beginning. So that repetition and that repetition of not just practice, but correct practice is very successful in getting people to master those skills. So when I thought about applying deliberate practice to what we do in obstetrics, that is way too time consuming. We don't have that much time to practice. So I kind of fudged a little bit and came up with a version of deliberate practice where the team goes into the simulator area, whether that's a patient room or a room in a simulation center, and they go through step by step what they're going to do in the simulation before they run the simulation. And I'm sure people are saying, oh my God, you can't tell people what's in the simulation before they go in to do the scenario. Well, it depends on exactly what your goal is. If your goal is to test clinical knowledge, then you would not want to give them the scenario. However, what is your goal for simulation? It My goal always was to improve team performance, to make sure that when the team gets in the situation, whether it's hemorrhage, whether it is sepsis, whether it is cardiac arrest, or severe onset pulmonary edema, or preeclampsia with severe features, doesn't matter what it is, you want the team to perform optimally. So we have all of these foundational steps that we need to have in place, which is scope of practice. What is the scope of practice in your unit? What patients are you going to keep? What patients are you going to transfer? Evidence-based guidelines, and then checklists that are evidence-based because they are derived from the guidelines or protocols, whatever you call them, and they are specific to the processes on the unit. So those are the foundational pieces that you need. So when you go into deliberate practice and you're focusing on team skills, you're looking at the checklist, you're looking at the scenario, the patient situation, but your goals are, what is the best time to call for help for this patient? And what help is needed? So who do you need to call? And when do you need to call? So what are your goals when you go into deliberate practice and you're focusing on team skills? Now, you're going to focus on, obviously, the topic of the simulation and the patient situation. But in regards to that scenario and that patient situation, when is the best time to call for help? Who is best to call? If you're in a small hospital and you don't have a lot of people in your unit, how do you get people to the room in a timely manner? If you have a rapid response team, what are the criteria for calling them? When is the best time for them to be called? That discussion can occur during deliberate practice. Role delegation, using your checklist with the people you have available in the simulation training What is the best way to divide roles up? And what tasks go with those roles? Now, your unit may already have a role delegation strategy, so you want to follow that. But if your unit doesn't have a role delegation strategy, then how are you going to divide up tasks into roles? Talk about communication. What needs to be communicated and when? So let me give you an example. One of the teams that I worked with were going through a hemorrhage simulation, and their checklist was divided into phase 1, phase 2, and phase 3 of hemorrhage. Every time they went from one phase to the next, they did a recap. So they quieted the room, reviewed what was going on with the patient and what was going to happen next so that everyone was clear on what the plan of care is. And that is not a long break. It's maybe a minute break, and the team is better coordinated and ready to go into that next phase of care. So you can also, in the deliberate practice, talk about what needs to have closed loop communication. For instance, medications. You may decide that medications and blood need closed loop communication, and direct orders from the physician also need closed loop communication. So the team can determine when they're going to utilize closed loop communication so they can replicate that in the simulation when they go into practice. So how will the team maintain situation awareness, particularly if you only have one physician responding? How does the team maintain awareness about the changing status of the patient? So for instance, when you're talking about hemorrhage, oftentimes what's going to dictate the plan of care is what are the patient's vital signs and how much are they bleeding at this time? Or how much blood have they lost? Are they still bleeding? Those two pieces of information need to be in every single recap because that will guide the strategy and the plan of care in the next phase. You need to have easy access to patient information. Many times when I go into a unit, the documentation system and the access to all of the patient's information is right at the head of the bed. In a lot of emergencies, that is a very awkward place to have access to information. If you have a leader, most of the time the OB leader is more at the foot of the bed or at the side of the bed. If they're right at the side of the bed by the computer, that's convenient. But if they're at the foot of the bed, or in case of a maternal cardiac arrest, you may have an anesthesiologist, a code leader, and a obstetrician or maternal fetal medicine who's ever there at the in the another part of the room, usually at the foot of the bed, discussing the patient. And that's where you need the information. So if all of your computer is up at the head of the bed where all these people are trying to work on the patient, it's harder to relay information to the back of the room. So consider a mobile computer system where you could move it around wherever you need that information. Or maybe you have a mobile documentation system that you can bring in just for an emergency, because I understand that the computer is placed where it is because it's convenient for a labor and delivery patient. However, or a postpartum patient. However, in an emergency, that may not be the best location. So the team can work through this and figure out what is going to be the best way to get information about the patient to the people who need to devise the plan of care. Next, your checklist. Checklist is excellent for helping you anticipate and plan what's going to happen next, making sure that all of the tasks that need to be done for the patient have been done. We all know there is a flurry of activity at the beginning of any emergency to get people in place to get the priority tasks done. And the checklist can help with this. So, how are you going to utilize the checklist? I recommend that you have one person consistently responsible for the checklist. That person can make sure that things are getting accomplished, that we have everybody that we need in the room to complete the tasks that need to be done. Or if a lot of the tasks have been completed, who can go back into patient care, who can leave the room and go do other things on the unit. So the checklist is very valuable in that situation, and how you're going to use the checklist. What kind of communication is going to occur between the leader and the person who has the checklist? All of these things, and these are mostly all team skills, can be discussed, thought about, and planned for before the simulation, so that when you're in the simulator, you are actually practicing, number one, correct clinical and technical actions, because you've practiced those. And we have, in deliberate practice, if we see an error, we stop, we correct the error, and we explain why the correction is the appropriate course of action. So you've had that correction. So you've practiced the technical and the clinical components, but you've also added how you're going to implement that knowledge and those skills through team skills. So the next step is to get into the simulator and run through the scenario. I strongly recommend that you use video when you're doing this. The reason why video is so important is because it is an objective record of what happened in the scenario. So the reason why that is important is, let's say you have decided to have a recap at a particular time, and when in the scenario, and when that particular point in the scenario occurred, the recap didn't get called. So the important thing here is not to say, well, Jane, you should have called the recap then. Weren't you paying attention? But to watch the video and to see what circumstances were occurring that prevented the recap from being called when it was. There could be any number of things. There was not enough people in the room. Therefore, the person who was supposed to call for the recap was not able to because they were busy. It could be that the recap was scheduled for the wrong time in that situation. So you want to change it. Maybe one thing we know about recaps is you want to make sure that the physicians, which are usually the anesthesiologist and the obstetrician, aren't involved in some task that really requires their attention and concentration. For example, you would not want to call a recap when the anesthesiologist is attempting intubation, because intubations during pregnancy are difficult. They require concentration, and it's best not to be bothering that physician, the anesthesiologist, when they're trying to do the intubation. So, and there are situations like that for the obstetricians. And you can talk about these things in the deliberate practice so that you avoid them in the actual simulation. So when you get into the simulation, you're actually practicing these team skills to see how they're working. And you're also looking to see what circumstances either supported the optimal performance, or if the performance could have been maybe changed up or tweaked a little bit. What circumstances led to that, and what needs to be changed to have an optimal performance? So the important thing to remember when you're looking at any time you're analyzing performance and you're doing it using a checklist where you're going through a list of tasks that need to be done, look at why those tasks got done. they had the right number of people. I saw one simulation where they learned it required 3 people to hang blood on a rapid infuser. But once they had the roles figured out, they had talked through who's going to do what, and the 3 people were in the scenario, the minute the blood hit the room until it was being delivered to the patient was 2 minutes. So that improved performance, just utilizing role delegation and communication. The blood is in the room. People are ready. Everybody knows exactly what their role is, and the blood is hung quickly. So that's an example of what I'm talking about. Why did that work? It worked because they used communication and role delegation. It may be that a device needs to be placed, and that device either isn't present or it's not ready when it's needed. What led to that happening? And it could be that it wasn't anticipated that that device was going to be needed in this particular situation. Maybe it's an ultrasound equipment. Maybe it's a device to treat uterine atony. So maybe the device wasn't in the room. Maybe the device wasn't set up. Maybe no one in the room heard the request for the device. Potentially that needed to be put on the checklist so that the person holding the checklist can anticipate that this device is going to be needed and set it up ahead of time. So looking at the why did it happen or why didn't it happen is incredibly, incredibly important. So there may be other ways to practice team skills, but this is a way that you can utilize every single time you run a simulation training or every single time you are a participant in simulation training. Pay attention to why things worked and why things didn't work and how team skills can help you work more effectively together. So in my book, simulation-based training is number 1, practice. How do we work the best together? Number 2, learn. What are our teammates' challenges? What are their priorities? And how can we work best together so that all the patient priorities are met? And finally, reinforcement. Optimal patient care is reinforced not only in the deliberate practice, but the correct actions are practiced appropriately in simulation. So I hope that will give you some strategies for how to practice team skills and how to make team skills part of the culture on your unit. Thanks for listening to the Critical Care Obstetrics podcast. Don't forget, you can keep learning with us at the Critical Care OB Academy at clinicalconceptsiob.com and support our mission by joining us on Patreon at patreon.com/CCOB. You can also watch episodes on YouTube and be sure to follow us on social media to stay connected.